Good morning and welcome everyone. So want to talk about a topic that I know that has been a hot topic for a lot of folks, and that's around health equity. And I know a lot of groups have been working on their health equity plans only to struggle as to what's really needed. And so today we're going to start with one of the priorities that CMS has identified that's important when we're talking about health equity. And I'm really excited to have Dr. Fazia Khan with me here today from Persivia to talk about these important data sets that are necessary. And so the first one that we're going to talk about is priority one, and that is expand the collection, reporting, and analysis of standardized data. And just want to talk about, what we're dealing with, which is different than what it's been in the past. And so CMS is really asking us to expand that data set, and they've identified something called SPADE. And so each letter stands for one of 7 elements that they're wanting us to collect. And so those include in that patient assessment tool, collecting not only race and ethnicity and preferred language, but whether or not there's a need for an interpreter, health literacy, transportation, and social isolation. And so these are all, a lot of these are new data elements that we're being asked to collect. And I know that, out there in our industry, we've talked a lot about how difficult it is getting that information and then also bringing it together in a way that makes sense and is usable. And so I want to start the conversation by asking Dr. Khan, you know, um, talk to us about SDOH and how you see machine learning being something that can help us get at capturing social determinants of health in a meaningful way.
That's a great question, Dr. Decker. This is a great step by CMS by introducing Z codes and giving us SPADE, because we can now capture more structured data from our patients. And we can look at data completeness as a whole, and we can analyze the data in patient charts, and we can compare and set benchmarks. And machine learning can help us with that. For instance, we can take food insecurity, for instance, and check how many Z codes we have around that, or housing or transportation, and then look at the text through machine learning and compare the Z codes with what's present in the text. Beforehand, we were looking at just capturing these data sets, and we said that, okay, we made AHIMA did a study last year or earlier this year that we are about 70 to 80% there on capturing some of the data, but that is just one step. Now with these Z codes, machine learning can help us to figure out how much of that data is actually meaningful when you compare it with the data captured in the notes. So that's a big step forward. Another thing is that we can set up benchmarks and compare that last year we captured X number of this instance of housing insecurity, and this year we captured more. So these type of initiatives are now possible with Z codes. What's really exciting is that it also opens doors to do more. Health is not just restricted to a doctor's clinic or the EMR. So now the innovative community will set in and they can really be creative. How can they use these Z codes, right? So if you take some of the things that Dr. Decker, you've talked about, that now some of even the upbringing and our health literacy and things which are not really easy to filter down to a code can be captured by this code. So how are we going to now use this information about an individual? So there's a new way to think about it. I think that's also very interesting, and where the market, industry, and academia takes us is open right now. Another thing machine learning can do once we have a better data set is to look at predictive analytics. We can write algorithms to look at a patient level, where we can identify if you belong to a certain area, for instance, what are the chances and predictions for that patient. And we can look at these large data sets at a population level and say, okay, if we are coming from this zip code or with this background, with these type of S2H data? What are the predictions? How are the diabetics from this area going to behave in 10 years? How does this health literacy impact us? Housing insecurity impact us? So I think machine learning can play a vital role there also.
I think you bring up really two really good points. One, the idea about predictive analytics and us being smarter about that. We know in a webinar, right, that we did, that we talked about how V28 is going to change
Mhm.
how we look at particular diagnoses, and it's going to really be upon us to make sure that we're managing real-time conditions. And so, to the extent that we can understand and discover those illnesses early so that we're making sure that we're reporting on them, we have a better opportunity to line up, right, the reimbursement that will be required to run the programs that are necessary. But the other thing that I thought you brought up is looking at populations. And so CMS was very demonstrative, right, in this briefing that they shared, that it's not just about individual patient conditions, but also
Mhm.
too being able to be in a better position to respond, especially when we looked at how disparities, right, bubbled up during COVID. And so, you talk about trends and being able to, see information about particular populations. Can you talk a little bit about how physicians, right, how health systems might be able to bring this information together, aggregate it together, not from only the perspective, right, of the individual patient, but then also being able to apply it and come up with programs that address whole populations?
Absolutely. I think going forward, we'll see that S2H information will play a bigger role in population health management. And we can do many things with this information. We can even look at our service lines, that if we have a population who have a need for a certain service line, OBGYN, cardiology, we can match that need. For instance, the hospitals can align their resources and also bring in community resources and line them up with their population. Say, okay, we have a very high proportion of a population which needs some resources for food insecurity, so they can line up those. They can set up certain units within the hospital and really impact these kind of S2H information and take care of their population. So that will play a key role going forward. What is open also is how will the rest of the world response. It's not the job of just the hospital now, right, to respond to this. How will the hospitals and the local bodies and the communities and these food pantries, for instance, in this case, how will they all come together and collaborate? That's why we always envision Persevia as this collaboration platform where every entity can come in, whether it's the social services, whether it's the communities, faith led organization. So it's very interesting that this opens a door for a true collaboration to come out of just the hospital and the clinics and really bring the community and support structure around a patient together.
Such important points, and definitely, I think, really helpful advice as we're looking at writing our health equity plans and really making a difference, right? It goes beyond lip service. And I love that Persivia can do that
Mm.
for us, and that understanding that it really takes, right, more than one entity, that we have to bring together all these organizations, right, are important, that need to get involved. And it's no longer, or should never have been, right, the burden of one or two people, but really bringing everyone together in a way in which this information, right, makes sense and can help improve outcomes for patients overall. Great.